You guys might have heard about Kegel exercises, but how exactly do you do one? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're talking about Kegel exercises for men. Yep, you guessed it. They aren't just for women. If you've ever wondered how to improve your bladder control, support your prostate, or even turn up the heat in the bedroom, you're in the right place. In this video, we're going to talk about what Kegel exercises are, why the science says they work, who they're great for, and who should skip them. Plus, I've brought an expert on pelvic floor exercises, a pelvic floor physical therapist, Eric Lekie, who's going to teach you step by step how to perform Kegel exercises. So, what are Kegel exercises? Think about your pelvic floor like a hammock of muscles or a bowl of muscles running from your tailbone to your pubic bone. These muscles, specifically the pubococcygeus or PC muscles, support your bladder, prostate, and rectum. They're important for the ability to urinate, hold your stool in, and have good sex. They're also part of your core. They're important for stability and normal function. Kegel exercises are simple exercises used to strengthen this hammock. They were named after Dr. Arnold Kegel, who introduced them in 1948, and they're essentially a form of pelvic floor muscle training. This was initially developed for women to address leakage of urine after childbirth. However, they are just as important in men because, like in women, these muscles can weaken due to aging, prostate surgery, diabetes, and other factors, leading to issues like urinary leakage and sexual problems. Now, the good news. Several studies have looked at the effectiveness of exercises like Kegel exercises for men. In 2005, a study examined the role of pelvic floor exercises in restoring erectile function. This randomized controlled trial included 55 men with ED. The intervention group received pelvic floor exercises plus BOF feedback using patches to monitor contractions, while the control group received lifestyle advice. After 3 months, the intervention group showed significantly better improvements in erectile function. After 6 months, about 40% had regained normal function. They also saw significant improvement in post-void dribble, that little dribble after urinating, in the intervention group. However, I must note the study's limitations. About 40% of participants dropped out. This matters because these exercises require consistency. Like any workout, they don't work if you quit. They can be time-intensive, and some feel progress is too slow. Just as with building other muscles, results vary, especially if starting from weakness. Another study, a 2019 systematic review by Myers and Smith, analyzed 10 studies and found that Kegel exercises improved erectile dysfunction and premature ejaculation. For ED, all 5 trials showed improvement, with cure rates up to 47% when paired with BOF feedback. For premature ejaculation, one study reported 55% of men, 43 out of 78, resolving it completely, while another saw ejaculation time increase from 39.8 seconds to 146.2 seconds in narpa. Urologists often prescribe these exercises post-prostatectomy, as surgery can cause urinary leakage during coughing, sneezing, or lifting. Multiple studies confirm pelvic floor exercises reduce leakage over 24 hours, especially when guided by a certified pelvic floor physical therapist, like having a gym trainer. Lastly, while evidence is limited, stronger pelvic floor muscles may enhance orgasmic intensity. During climax, these muscles contract. Greater strength could mean more powerful, satisfying orgasms. Who benefits? Men with ED, premature ejaculation, urinary leakage, or post-prostatectomy issues. Who should avoid Kegels? Those with pelvic floor dysfunction. Symptoms include chronic pelvic genital pain, pain during orgasm erection, chronic constipation, or urinary urgency dog frequency. If you have these, get evaluated first. Also, avoid Kegels post-surgery or during a UTI until cleared by a doctor. Eric Lekie's instructions. Hi everyone, I'm Eric Lekie, a pelvic floor physical therapist and YouTuber. Today I'll teach you pelvic floor contractions, Kegel exercises. First, identify the muscle group. Lift your scrotum. The spongy area underneath is your perineum, pelvic floor. To start, sit at the edge of a chair, scrotum hanging off. Place 2 fingers, dominant hand, lightly under the scrotum over the perineum. Relax, breathe deeply, and focus. Contraction techniques. Imagery 1. Stop urine flow. Breathe out fully, then contract as if stopping midstream. Release. Imagery 2. Lift your nuts to your guts. Imagine cold water retracting the scrotum. Contract and release. Avoid clenching butt abdominal muscles. Start lying down to isolate the pelvic floor. Progress to sitting, standing. Begin with 10 reps. Breathe in, out, contract, on. Exhale, release. Focus on quality, not quantity. Use fingers to confirm.
Progression. Start with 30 reps daily. 10 morning, 10 afternoon, 10 night. Advance only when contractions feel clear and controlled. Patience is key. Pelvic floor strength builds gradually. Don't rush. Dr. Malik's closing. Thanks to Eric for his expertise. Check his channel for progression tips. Subscribe to our channel for more. It's free. Take care of yourself because you're worth it.